I'm Dr. Mike Chehval. I'm a urologist. Urologists deal with the urinary tract in males and females and the reproductive tract in men, which includes the prostate. I'm a clinical professor of urology at St. Louis University, and my practice is primarily at St. John's Mercy Medical Center. The task that we're going to undertake at this time is to discuss the prostate, its function, and the diseases that may affect the prostate. The prostate is a gland that's very much involved in male reproduction. The volume, the bulk of the volume of seminal fluid is actually produced by the prostate gland, and the prostate sits at the base of the bladder in a situation here, so that urine from the bladder passes through the prostate. The seminal fluid is the portion that's produced by the prostate that mixes with secretions from the testicles, the sperm, and this is the fluid and the vehicle in which the sperm are ejaculated. The location of the prostate, however, makes it a target organ in men, in that the prostate, as it enlarges, as it does so in older age, can begin to produce blockage or obstruction to the outflow of urine. The prostate is like an orange with an outer peel and an inner pulp. Prior to age 40, the inner pulp is quite small and comprises less than 10% of the volume of the prostate. After age 40, that inner pulp begins to grow and enlarge as a normal benign aging circumstance. But when it does so, when the prostate begins to enlarge, it can restrict the outflow of urine from the bladder and make it more difficult, or in some cases impossible, for the bladder to empty. That's a situation called benign prostatic hypertrophy, or BPH. And it's a circumstance which can be checked for and examined with a simple digital rectal examination. The symptoms that accompany this enlargement of the prostate is a decrease in the force and the flow of urine from the bladder, and inability or difficulty in emptying the bladder. So as a result, men develop more frequent urination. They develop nocturia, or the situation where they need to arise at night several times to gain emptiness to their bladder. And this is a situation that can be helped with medications, or as it progresses may ultimately result in an operative procedure. The signs and symptoms of benign prostatic enlargement are well known to primary care doctors and to urologists, and the digital rectal examination can give an idea as to the size of it, or the degree of enlargement of the prostate. The other thing that can occur with the prostate is that it is very susceptible to developing a cancer. The incidence of breast cancer in women is about 1 out of 9 women will develop a cancer of one breast or the other. In males, 1 out of 11 men will develop cancer of the prostate, which is a process that usually presents after about age 50. The way to diagnose, the way to determine cancer of the prostate is with early detection. Prostate cancer doesn't produce any symptoms until it progresses to a relatively advanced stage, when it may no longer be curable. The way to examine for, or to screen for, prostate cancer is with, again, a digital rectal examination to feel the prostate through the rectum, and the use of PSA, or prostate-specific antigen. The prostate is the only organ in the body that produces PSA. So if the PSA becomes elevated, it's indicative of something going on in the prostate, although that something isn't always cancer. Just the benign enlargement that men get will elevate the PSA. Infections or inflammations of the prostate will elevate the PSA. And other traumatic injuries to the prostate will elevate PSA. The only restriction on obtaining a PSA is it shouldn't be done within 36 to 48 hours after ejaculation, because sexual activity can also elevate that test. The normal level, the average level of PSA is 0 to 4.0. If the blood test is more elevated than that, then it's reason to do further evaluation. The PSA is a very sensitive test, but it's not very specific. And as I said before, if the blood test is elevated, it is indicative of something going on in the prostate. If the PSA is above 4, which is a higher level than normal, and below 10, the likelihood of there being a cancer is really only 1 out of 5. One way that we can help differentiate the PSA elevation from benign enlargement from the PSA that's more indicative of cancer is to do what's called a free PSA. Free means that the PSA, the blood test, is not bound to any protein. And in situations where elevation in the blood test is due to the benign enlargement, the free PSA should be greater than 25%, so that this helps to differentiate what PSA is a concern for cancer and what portion of the PSA is just indicative of the benign enlargement. The cancer of the prostate is the #1 cause of cancer in men in the United States, but it's still the #2 cause of cancer deaths in men in the United States. So there is a conventional wisdom or a statement that states that men die with prostate cancer, not because of prostate cancer. As a #2 cause of cancer in men in the United States, more men die annually from cancer of the prostate than all of the persons, men, women, and children, who die of motor vehicle accidents in the United States. So if it isn't addressed, then it will spread, and it will or can be a cause of death in men. So that the annual use of a digital rectal examination and the blood tests are the recommended screening modalities for men over age 50. There is very definitely a genetic predisposition with prostate cancer, where I stated 1 out of 11 men in the United States will develop cancer of the prostate. In Afro-American men, because of a genetic predisposition, the incidence goes up to about 1 out of 9 Afro-Americans will develop cancer of the prostate. And in Asians, the incidence is much lower, possibly as low as 1 out of 40. So that if you have a first-degree relative, if a male has a first-degree relative, a father, a brother, possibly even a grandfather or uncle, the incidence of prostate cancer increases from 1 out of 11 to 1 out of 9. In those circumstances, we would normally recommend that screening begin sometime before age 50, probably at about age 45 or even 40. There is no question that the early detection of prostate cancer has had a great impact on the death rate from cancer of the prostate. At one time, 10 years ago, the annual incidence of cancer deaths was in the range of 40 to 43,000 men a year died of prostate cancer. With early detection and treatment, the incidence is now closer to 35,000. So it has made a difference, and it has decreased the number of people who have died of this disease. There are no early symptoms of cancer of the prostate. The symptoms are somewhat similar to the symptoms with benign enlargement, restriction of urinary flow, until the tumor spreads, which is generally to the bones. And then there can be debilitating bone pain related to the spread of the prostate cancer. So as urologists, we would recommend that men after age 50 have an annual digital rectal examination to determine the degree of prostatic enlargement, the benign enlargement, but also to feel for any lumps or bumps that may be indicative of cancer, and then also a prostate-specific antigen or PSA.